today we are going to do a cystotomy in a pug. So this pug is facing a problem of urinary retention from past 3 days, and he has come from approximately 200 kilometers away from my city. And the primary care vet over there, they have tried to catheterize him, but they were not success in that. So they were not successful in that. So when we did our primary investigations, we found that there is a large number of calculi that are lodged in the urethra, and this dog is not doing good because blood report shows elevated renal profile and liver profile as well. So this dog has a urea of around 200 and a creatinine of around 3. So and he has a low pulse. So we are now going to do his surgery. Before surgery, what we have done is we have tried to do a retro hydropulsion, and we cleared the urethra. So in this very method, I used thick gel, the gel that we use for ultrasound. So I injected this gel via urethra, and that dilates the urethra, and with the help of catheter, those calculi are lodged back in the bladder. And now we are going to do his surgery. Uh, he has a low BP, and the anesthesia that I have used here is dexmedetomidine, and along with that I have used buprenorphine, and then propofol at the dose rate of 2 to 3 mg per kg body weight, and then he's maintained on isoflurane 1%. So he seems critical, and he require post-operative hospitalization as well. So yeah, let's start with the surgery. So okay, so now this is all sterile thing. We have sterilely placed this catheter as well. So now I'll ask my attendant to lift this like this. इसको पकड़ो ऐसे. Okay, so I'll give a midline incision all the way from here. There's two approach. One, you can go via midline, and then you have to come curved, and then other approaches you can simply give an incision over here, and then you can lift the things up and go. So what I can do in this case is I will give a paramedian approach. So I'll give incision like this, rather a midline approach. And then I'll take care of the vessels, and then with the help of इसको propofol और देना पड़ेगा. He's getting lighter. सीधा 4 ml propofol लगा दो उसको. So now with the help of the medicine bomb scissors, I'll try to find my midline of the linea alba. So here it is. If you guys can see the white line, you can able to appreciate the so this is a white line. This white line is a central midline linea alba that I'm going to get my incision through. Okay. I can also do is that I can put some gulpies retractor to get a clear vision. So can we have a gulpy retractor, please? So this is how I can put first gulpy over here, and then I can put another gulpy like this. And now this is a midline for linea alba that I'm going to incise now. And here it is. Now, okay, I'll go inside and find my bladder. As we have taken out all the urine from the bladder, so using smart glasses there. Mildly dysplasia में शोल्डर जॉइंट्स ओके ठीक है इसको वो दे दो फ्लेक्सिडिन और गावा पेंटिन सुबह शाम ग्रापीटेल ग्रापीटेल देना है और कैरोडल. So this is my bladder. To so there it is. So you can see how angry the bladder is looking. For a while, I'll take out this gulp retractors. Okay, can I have 30 polyamide, please? So what I'll do is I will cover uh, like this, and I'll give a stay incision or stay suture at the neck here, so that you can and I'll attach this with the help of cartoscope. Now I'm going to make my incision. So I'm ready now. Good. So now I'm giving my incision in the bladder. You can see the urine that is coming out. I'll go inside and try to take all my calculize. So here we are. एनेस्थीसिया कम कर दो, इसकी बीट नॉट स्लो हो रही है। एनेस्थीसिया एक में कर दो। Give half dose atropine, छोड़ दो उसको, half dose atropine. So this dog is now creating a problem. His pulse are getting lower. Bottle तेज कर दो. Half dose atropine. So we will be giving half dose of atropine. That will be somewhere around 0.3, 0.3 ml. You can see how fragile this bladder wall became. Atropine half dose. Anesthesia भी 0 करो फट से. Okay, so what I'll do is I'll take this out and एक वो देना मुझे NS छोटा वाला. So now he has started maintaining the BP again. So now the BP is 110/89 with a mean of 93, which is quite good and desirable. Previously, he was having a low BP, low heartbeat and low pulses. You can see all this wall of the bladder. It was a quite an old standing case. So now the heartbeat has 10 ml की स्टेराइल सिरिंज दे देना. So the heartbeat is now around 71, which is good, desirable. Right now we have switch off our gas anesthesia just to make him lighter, and then we will again start it up with इसको ले लो. इसको और पीछे खींचना थोड़ा सा. Now I am थोड़ा सा और थोड़ा और बस प्रेशर से डालो उसमें. So now what I am doing is I am injecting NS with the pressure in this catheter, and I am blocking the the base of a bladder at the trigone level, and my attendant is actually flushing it pressure with the pressure, so that if there is any calculi lodging inside the urethra will come up. So yeah, yes. I will repeat this procedures many times to get it sure. You can see these are the small calculi that are. Don't worry about that. छोड़ दो इसको. चलो करो. Yeah. So there are. See, these are the big pieces that actually go back at the level of urethra and may cause problem at later stage. So you need to always flush the urethra while surgery, so that many times. So let's see, there's another one. Yes. Hmm. Hmm. नहीं, ग्रेपिटेल और कैरोटिन एक साथ नहीं. ग्रेपिटेल ही लिखो उसको, कैरोटिन काट दो. एंड मेगा फ्लक्स पाउडर. ये सो जेरी श्योर एक गोली सुबह शाम. Yes. नहीं. Hmm. So I'll repeatedly flush. थोड़ा सा कैथेटर को और बाहर लेना. अब एनेस्थीसिया एक पे कर दो. He's getting एक पे. थोड़ा थोड़ा सा और खींचो, थोड़ा सा, ज़्यादा नहीं, थोड़ा और, बस प्रेशर से करो. Great. See, these are the small calculi that actually lodged back, and these need to get cleared. So always when you are doing a cystotomy, try to flush. See, try to flush the urethra by blocking the trigone, so that with pressure, if there is any if there is any stones that has lodged in uh, the urethra, can come. So at least do it like 8 to 10 times. Clear all the stones. You can see I'm still getting it. Yes, full. I have not given this much big incision but the wall of the bladder is so weak and fragile that the incision got extended. For at least 15 days like that. Hmm. Right. Okay. So I think we have cleared everything. So now we'll place this catheter back and we'll change our gloves, and then we'll continue with further. So I'll use this to hold penis, and then बंद डालो उसको. Look now. Okay, so we'll change our gloves. तो भी change कर लो. And I'll remove this as well. And we will wear another pair of gloves, and then we'll continue. So now can I have 30 PDS please? Excuse me. Right. एक नया लैब स्पंज दे देना. So I'll now repair the wall of bladder with the help of 30 PDS. I'll use non-traumatic. इसको उधर का छोटा काटो, उधर का इसको छोटा काटो. This is the wall of this bladder is really small. Thin, but I'll try to give my suture in 2 layers. So I'm taking the inner wall because this is a long cut. So Uh, um, Okay, so now I'm going to do my second layer of closure. And here I'll take small bites. So I'm suturing via continuous suture pattern, and for this long uh, incision I'm placing my bites at approximately 1 mm, 1 to 2 mm distance. बीपी एक बार रीड करना फिर से बीपी रीड करो. So I always go for 2 layer of sutures in case of a urinary bladder. And I'm going to, lavage the cavity as well. पानी ले जो वो फ्लश करने के लिए NS. ऐसे पकड़ लो इसको हाथ से ही, बहुत ज़्यादा खींचना नहीं है. एक लाइट कम कर देना तो उसका कम कर. Got it. Okay, now I'll lavage this cavity with. Before that, what I'll do is I'll do a mental patching of. So I'll just grab some momentum and I will try to place that over a bladder like this, and I'll tag this with my 30 cutter. So mental patching is a very good technique, and we should always do that because this really helps in healing the tissue very fast, and also chances of leakage are quite less. Take this and this. Oh, okay, so now I'm going to place this bladder back in abdomen. We'll lift the cavity up a little bit and we'll flush it with the help of full suction. So my attendant is actually lifting the abdominal wall up, and I'll be just flushing this with the help of cardboard small dollar. That's okay. Okay. Now can I have uh, zero polyamide, please? 0, 20 20 या 10 होगा तो so now I am giving sutures for closing the abdominal cavity. इसको निकाल दो. कैसे हो इधर बस खींच के रखो इसको. Okay, so now I'll remove this gall piece. इसका section करना है यहाँ पे. And I'll start my incision. Here I'll start my suturing from here. Before that, I'll give a combination of lignocaine and bupivacaine. इसको एक बार फिर से propofol दे दो. Now the animal is getting lighter. So I'll inject combination of lignocaine and bupivacaine all around. वो सेक्शन देना, सेक्शन करो यहाँ पे, रीडिंग हो रही है इधर। इसको नहीं, इसको नहीं। So I'm taking a bite of abdominal muscle followed by the subcutaneous muscles, just to, you know, leave any dead space which can cause seroma formation in post-operative phase. Okay. And I'll keep the catheter for at least 24 hours. This is a sterile catheter because he has to be he has to be on a, you know, CRI for at least 24 hours to flush all his creatinine and elevated urea. So we need to monitor his urine output. So right now he is doing good with respect of the ECG and his heartbeats. and BP. And we have again switched him to isoflurane 1% because he was getting lighter. So LNX वगैरह नहीं देना है. हाँ, बस पहला देना, कुछ नहीं देना. Great. So we have done with our surgery at this part, and I'll do some skin sutures as well because this is an outpatient, and we'll give some absorbables to cut this. So basically we don't have a need of it. You can see the suture line, but still we'll try to we'll give some absorbable ones. So yeah, this is it for the surgery. Thanks for watching, and we'll continue to live stream some more surgeries whenever I receive them. So yeah, please take care of yourselves, and bye.